learned after several tests that I would have to go in for a bone marrow biopsy. I did a little research and figured out what that was. And by the way, how many of you have been experienced either giving or being part of giving a bone marrow biopsy? Okay. From a patient's point of view, I did a little research and I went, oh my gosh, they're going to drill into my hip? And then I walked into the exam room and I saw those tools. Pretty intimidating. It's like, oh my gosh, they almost look like power tools or something. And so I was really tense. What the doctor and the nurse did to handle that was one of the most amazing things I've ever experienced in my whole journey, and I want to share how they handled it. Right off the bat, the doctor said, yeah, Peter, a lot of people find this to be a very difficult procedure. But here's what we're going to do. We're going to talk you through it each step of the way, and I'm going to ask you questions and have a little dialogue with you. Will that be okay? And I said, sure. And that's exactly what they did. He talked me through each step of the way. The nurse did the same thing. At one point, the nurse held my hand. At another point, she just sort of very gently said, it really helps if you breathe. And they just so gently guided me through. By the time he was done, guess what my reaction was? It's over? Yeah, is that it? Is that, you know, I mean, it certainly hurt and all that, but it was nothing like the terror. And I think the way the doctor and the nurse walked me through that was a great model of great care. I have some bullets up here of what they did, of how they made that such an effective experience. Being really clear up front, walking through, telling me what's going to happen next. Here's what you're going to feel. How are you doing? That dialogue, it was really a great model. And I'd like to present this model to you, not just as a model for handling a procedure, but also as a larger model for dealing with those of us who are going through the stress of learning you have cancer. It's not just how do I get through this procedure, but you have that anxiety in general. I'm sure you all know you have patients who are just terrified. And the thing I found was that when there was uncertainty about something, it was terrifying. Uncertainty is a vacuum, and your fears and anxieties take root in this vacuum. I compare it to a petri dish. When there's uncertainty, you don't know what's going to happen, your anxiety takes root and sort of multiplies, just like a culture in a petri dish. So everything one can do to fill in that void of uncertainty with clear, tangible information is really, really helpful. I always appreciated that all the way through. It makes sense?
Yeah.
And just think for a second. I know this is probably second nature to all of you, but what are the things you can do when you know everything cold, you know it in your sleep, but that patient, it's just a void, an empty petri dish. How can you prevent the anxiety and the fear and fill it in with specifics? That's the key theme I wanted to stress.